Today I would like to talk about my thoughts on breast implant illness and the process of how this comes about. But to understand that, what I feel I need to do is give you a quick little summary of how I view health and disease. And if we can envision a scale, and if we get good nutrients in, keep the toxicities out, live a nice lifestyle by getting exercise, meditation, yoga, healthy nutrition, we really build the body up, and we also keep the toxicities down, and the body stays into the health state. If we start to change that, if we lose some of those lifestyle habits or don't eat a good healthy diet, or we start to get more toxicities in with smoking, stress, the cortisol levels, chemicals, pollution, all these different things, then that scale tips over. Once it tips in the wrong direction, we then start to see disease processes coming about. And that is one of the reasons I think that we start to see aging and health issues, in particular with breast implant illness. Now, what will happen is a lot of ladies will get breast implants, whether it's from lack of development, just from genetic aspects, whether it's from postpartum breast changes with involution or flattening of the breast with a little bit of droopiness, or heaven forbid, if it's from breast cancer, that you've had a mastectomy and you need an implant for reconstruction. The bottom line and connecting aspect of all this is that the woman is trying to regain her body image, her self-esteem, and self-confidence. So once those implants are placed, what some women then feel over starting within a few months, maybe even a few years, to start to get some chronic fatigue. And this continues to build up and beyond what would be normal for their age. They will oftentimes go see their primary care physician and talk about things, do some thyroid testing, some other type of testing, and everything comes back negative. And then they're told, well, you're just getting older, you have 2 or 3 kids, you're just depressed, here, take this antidepressant. However, things continue to get worse. And usually the second complaint or symptom they have is called brain fog. And this is just something where it's difficult to think clearly, or you're talking and in the middle of the sentence you can't think of the next word that you're trying to pull forth. And so this continues to get worse and worse. Again, there are myriad of symptoms after that, where ladies will then talk about having alopecia or hair falling out, vision problems, hearing problems, joint aches, muscle aches, rashes, aches, pains, and it's all over the body. And that is what is so confusing to the physicians and the healthcare workers, is there isn't a set way that these symptoms come about. And I think it has to do with our genetic differences, and that is something that we will talk about in a future video. Once they're told nothing's wrong by the medical professional, the patient knows something's wrong. Her husband or significant other sees that in them. They can't get down and play with the children. And a lot of ladies can't even go to work. And so everything continues to spiral. So the relationships, the financial aspects, yet they're feeling worse and worse. At this point then, what many people will do is get on the internet and they'll search illness and just put in breast implants, and the combination oftentimes will bring ladies to a website, a Facebook site that was created by Nicole DeRuda, called Breast Implant Illness by Nicole. And as of this recording in late March 2020, there are over 112,000 women on this site. It can only be women. Men can't be on this. Medical providers can't be on it. You have to be pre-vetted and have symptoms and be a breast implant illness patient to be able to log on to this site. And what many of my patients will relay to me is that once they find this site, they sit there for hours. They read other women's stories, testimonies, and they sit there and cry. And it's sometimes cries of relief, because they say, maybe I'm not crazy, or I'm not going crazy. Maybe there is a reason that I'm feeling this way. Maybe it's my breast implants. Again, we don't have a definitive test. However, this does give them a gleam of hope that they might be able to get well. And what they then start doing is starting to search for physicians in the country who believe that breast implant illness could be a reality, and then search and then seek consultation with them.